The remarks by our sister here, very touching. And maybe I'll make a few remarks before I inflict the official speech on you. And it mimics almost exactly what the minister said. But I want to say I can empathize with what she's going through because she's just one of many of our citizens and countrymen and women who are going through what she just talked about. And the perception was that if you were rich, it was a disease for the rich. Hypertension, cardiovascular diseases, diabetes were diseases of the rich. But increasingly, we see that it's inflicting more the persons who are much poorer and can least afford to be able to manage those diseases. And that's why the Ghana Medical Trust Fund has come at the right time. I have a personal connection to non-communicable diseases, and that is because my father died in 2001, and he died of prostate cancer. My mother died in 2016, and she died of complications of high blood pressure and diabetes. My stepmother died of breast cancer. I lost a friend and somebody who worked for me last year. We celebrated 1 year since she passed. I'm sure most of you know Mawena Dumo. She died of breast cancer. And currently, I have a staff in my office whose son is in his 30s and is on dialysis, is suffering kidney failure. And so these are not things that are far away from us. These are things that are close to us. These are loved ones that we're talking about. And so like Prof. Saite said, we must not see them as statistics. We must see them as real lives that we need to touch and help. But there's the even sadder story of one of my confidants and strong supporters when I started this whole political journey. He was an assemblyman, and he was an executive of our party in Bole Bamboy, where I started my political career as a member of parliament. Very close to me, went everywhere with me. Anytime I went back to the constituency, he was in charge of the southern zone, and so anywhere I went, he went with me. And a few years back, he started to have a problem with his kidneys. And so at the time, there was no dialysis north of Kumasi. And so if you had kidney failure anywhere above Kumasi, you had to travel to Kumasi to do dialysis. And so he used to travel from Bole Bamboy like once every week to do dialysis, go back, and the cost was unbearable. I tried to help as much as I could. Eventually, he needed more, a dialysis treatment, and so he couldn't be going and coming. So he had to move his whole family to stay in Kumasi, rent accommodation in Kumasi, so that he could be close to Comfort Noche, where he was undertaking the dialysis. Sold his motorbike, sold his TV. And much as I also tried to support, the cost was becoming unbearable. Eventually, he died. And he died leaving poverty behind because he sold all his assets to be able to look after himself. And so we had to take care to support some of the children to be able to finish school and all that. These are real stories. And that is why what we're doing today is important, because it will touch a lot of lives and help a lot of our fellow citizens. But let me say that this program must be linked and will be linked to our primary health care project, which we are yet to launch. Because under the primary health care, we envisage that there will be volunteers and designated community pharmacies where our citizens, wherever they live, or the CHIPS compounds, will be required to go and take their blood pressure, check their sugar, because like was said by the UNICEF director, these diseases are preventable. And even if they have an onset, if you detect it early, you can have a favorable outcome if it's detected early. And so the primary health care would have community volunteers who will go from house to house occasionally, maybe every 3 months, every 6 months, and just take people's blood pressure, check their sugar level, and all that. We'll have a program where women, are able to detect lumps earlier to be able to get treatment in case they are developing breast cancer, and so many of these other things. So I think there should be a linkage between Mahama Care and the primary health care program when we launch it. But more especially, a lot of these diseases are caused by ignorance in terms of our lifestyles and all that. And so we must also, as part of the Ghana Medical Trust Fund program, launch a very strong awareness campaign so that people would know what the trigger factors for these non-communicable diseases are. I understand that some of them are genetic because you can inherit it from your parents in your genes, but a far greater number are lifestyle diseases. They are acquired. They are not genetic. And so if people just know, what their disposition is and they are able to make changes in their lifestyle, I'm sure that we should be able to bring down, the level of disease burden that we currently are seeing. I want to thank our brother from CalBank for the very good testament he made about the need for support by corporate Ghana in this particular exercise. And I want to encourage corporate Ghana, businesses, the mines, the banks, and all the other companies that this Ghana Medical Trust Fund program is coming, those is coming to help are your clients who save their money in your banks. They are your clients who do business with you. And indeed, they are not only your clients, they are even your own staff. Some of your staff have died, from breast cancers and diabetes and all that. And so, as part of your CSR, if you give anything, you are giving it not just to help people, but to help your own clients and your own, your customers and your own staff. And so, I'd like to encourage all corporate Ghana, that is private sector and state sector, to annually devote a portion of their community social responsibility to Ghana Medical Trust Fund, because it's going to do a lot of good to our country. I want to assure Prof. Adanu that while he was speaking, the many suggestions he was throwing out, I turned quietly to the Minister of Health and asked, "Are you taking notes?" And he quickly took his paper and started writing. So, Prof, you can be sure that note has been taken of the suggestion you made, and we want to thank you for that. I want to thank Prof.